So my name is Rita. I'm one of the staff nurses working at the Royal Brompton Hospital. I'm also one of the leads for the breastfeeding and expressing supports team there. At the Royal Brompton, we always try our best to provide quality services when it comes to breastfeeding services. And one of the reasons why I did this as my Masters for Imperial College was to try and combine my passion to improve the services that we provide for these heart babies, as some mums refer to, and on the other side actually do some research on the topic and finish and complete my Masters. The idea of the project was essentially to try and understand the experiences that breastfeeding families go through, and also on the other side also understand staff members and their experiences as well providing the service. The project is based on a methodology called Experienced Based Co-Design. So essentially I interviewed families and staff members. Then from there I did all the data sampling. So I analysed thoroughly all the interviews, and then from there I hosted an event for the staff members where they identified the 6 topics that they would think would be essential to prioritise and improving at the Royal Brompton for these babies with heart conditions. Then from there I did exactly the same just with families, and where families also identified their 6 topics and their priorities. And then finally, after having these 2 events, we had a main joint event, which is the families and the staff all together deciding from the 12 topics, 3 essential topics, which were family support, education for staff, and communication. So from those 3 topics now essentially have 8 teams formed with families and staff members all working together to provide quality improvement projects to future present to management and the Brompton Fountain. It's been a very positive experience for everyone. I think it's not only allowed staff to understand a little bit further what families go through and their journey within the unit and everything they are exposed to having these fragile heart babies. But at the same time, families understanding how staff work and what is needed within the units so we can provide this high quality service that we so want to.
I've been very pro for this event to happen, and I would want every single parent's mum coming on the ward with newborn baby to have the support and the help and the education they need to get through.
I feel that this has been a great experience to be involved with, just because I want to be able to give something back to other mums.
So I did the interviews the first time round, and it was really nice to sit in there chatting and kind of get really thinking about how we offer our support. And also today's been really useful because then I've been able to look at how the parents perceive the support we give and also the other staff, and it's quite nice to hear that the nurses kind of get good feedback from it.
The events have been really good. It's nice to actually feel like you're giving something back to the hospital that have obviously saved your child's life, so I was more than willing to come and kind of help out wherever I could.
It's the best project I've ever been involved in, and I think part of it is Rita's enthusiasm, and but also the process has enabled me to think about this area, which I would be honest, I haven't given that much thought about before. So I found it very positive, and I'd recommend it if anybody wanted to try the similar process to do something else.
I feel that essentially we've managed to reach our targets and our goals within the project, which was essentially to understand the experiences that families and staff members go through throughout this whole breastfeeding journey for our babies in our unit. Other side, I feel that already the unit is improving, so you can always and only say that it's been a successful project.